I see a lot of hip pain in my practice. A lot of my patients call hip pain this whole area. What I have found in a lot of patients who have chronic hip pain, this is assuming they don't have a super degenerative hip joint, something like that. These are patients who've already had those things ruled out, is that they have weakness in the hip, especially these lateral muscles, the muscles on the side of the body, because very few of us in our modern day lives do any exercise for these muscles on the outside of the hip. So when you have hip pain, it's pretty much unrelenting and you don't do anything for these muscle groups, it's a great time to learn some muscle strengthening to help your hip pain. I am Dr. Melissa Lockhart. I am a chiropractor in the state of Washington. So now I'm going to show you 3 exercises for hip pain that involve use of a band. This band is just one long piece of band material that I tied a knot in. The orange color is pretty tense. Most people are going to want to use yellow or green. Those are much more flexible bands. I've been doing these exercises for so long, I use a pretty tight, difficult band. If you find that your band is too loose, you can sort of choke up on the knot and make it a smaller circle. If your band is too tight and it's too difficult, you can loosen it a little bit that way. So really any color band works. You can always change where you tie the knot. They also sell bands that are already a complete circle without having to tie a knot. I like these because they're adjustable. And over time, I might want to change where my knot is and how large the band circle is. But really anything will do. As far as choosing a band, like I said, for most people, especially beginners, yellows and greens are pretty good. There's a red that's like a medium. That one works too. Ideally, though, you're going to want to get stronger over time and change your band color or possibly change where your knot is. So let's start with the band exercise for the hip that involves putting this band around the ankles. So this is exercise number 1, and this is where I start with mine. You're going to lie on your side, and I'm going to lie down like this and just rest my head, but you can be up on your elbow. It doesn't matter. You want your bottom leg bent and your top leg straight. And I'm going to slightly tilt forward here with my hip forward and my toe pointed to the floor. And that's really going to access these posterior lateral muscles of the hip. And what you do once you're in this position is just stretch your band. Nice and slow. Your band should be a little bit of a challenge, but you should be able to do 10 of these successfully with good form. If you've done 10 and you're feeling nothing, your band is either too light or it's possibly too loose. I'm not counting, but I'm going to do about 10 of these. These are for the adductor muscles. The abductor muscles in the hip. This is an area that nobody exercises. So weakness in this area is really, really common. I see this in my office all the time. So about 10 of those. You're going to bend your knees to about 90 degrees or so. I'm also flexed at the hip here. The band stays around my ankles. This is called a reverse clamshell. You're going to keep the knees together and stretch the band. Keep the knees together and just stretch the band. We're basically surrounding the hip joint here and hitting these muscles from a few different directions to support the hip. Joints in the human body love to have muscle strength around them. And this is what we're providing. So about 10 of those. Then I'm going to go ahead and move my band up to the knees. Just like this. Doesn't matter if it's below or above, just somewhere around the knees. Lie back down. So this is a clamshell, similar to the last exercise. Feet stay together. Knees come apart. Stretch your band. You will feel this lateral hip getting very, very tight. We don't use our abductors much. So this is a really nice set of exercises. We'll do about 10 of these. So you've done one set. I always do a second set. If you want to have results, you want to do a couple of these. So back to the straight leg. The toe is pointed slightly to the floor. The knee is straight on top, and I'm tilting forward just a tiny little bit. I'm going to stretch this band 10 times. Approximately. Okay, we're going to move up, reverse clamshell. Keep those knees together. Try to keep your upper body in one place. You don't need to be using the upper body for anything on these exercises. And don't forget to breathe. And then we're going to go up to the regular clamshell. Band around the knees and feet together. Stretch that band about 10 times. By now, you should be feeling some burn in here. It's a good sign. Now, regardless of whether you have pain in both hips, pain in one hip, you're going to exercise both sides. Always want to strengthen equally on both sides of the body. Always want to stretch equally on both sides of the body. That way we don't invite a new problem. Okay, so that was one side. We're going to switch and do the other side. Same exact routine. Lie down, top leg straight, bottom leg bent, toe slightly to the floor, and I'm leaned slightly forward. Stretch that band. So I have been a chiropractor for 25 years. And in doing my job for 25 years, last year I tore the labrum in my hip. It's a partial tear. It doesn't need surgery, but it really does bother me. These are the exercises I do. And because of these exercises, I can still do my job. I can still pretty much do the same adjustment I tore the labrum on. These exercises work really, really well for stabilizing a hip. You know, will I eventually tear that labrum further and need some kind of intervention? Maybe. But as long as I keep it strong, I stay relatively out of pain, and I stay relatively functional, and you can too. I probably tore that labrum because I had hip weakness. Okay, about 10 of those. And as you saw before, 10 clamshells. Okay, last one. 10 abductors, approximately. Some of my patients can't quite make 10. They have so much weakness that they're really only going to do 5 or 6. That's okay, as long as you start somewhere. You can build strength over time. You can add more. You can make your band more difficult. But you make this a regular routine. Now, how often do you want to do these hip exercises? When I first started rehabbing my hips, I did them about 3 times a week. That was enough, once a day. 2 sets of 10 on one side for all 3 exercises. 2 sets of 10 on the other side for all 3 exercises. Can you do them every day? Yes. I really don't think you need to. I think a few times a week is ample. These are pretty small muscles and they respond great to a little bit of exercise. Ten of the clamshells. And there you have it. We've exercised the lateral hip today to support the hip and to help with any pain you're having in your hips. Hopefully you can do these at home really simply. Bands are super cheap. You can get them anywhere. I'm Dr. Melissa Lockhart. If you have any questions about these exercises I've shown you today or anything else, you can reach out in the comments below.